Hi, I'm Cameron with Pharmacy Specialist, and today I'm going to be showing you how to administer medication via an elastomeric infusion pump. And that's what we have here. It's a pressurized ball of medication with a line that is pre-primed and ready to go. This is a more simple infusion process, and the acronym to remember for this therapy is going to be SASH. It's S-A-S-H. So we have saline, administration of medicine, saline again, and then heparin. So what I like to do is lay everything out in the order of that acronym. Okay, so I'll take a saline flush, put it down, the ball of medication, another saline flush, and heparin. It's good if you've got any kind of antibacterial wipe or spray to wipe down your surface area before doing so. Then we'll wash our hands or use hand sanitizer and put on gloves. So the first step is going to be our saline flush. Now, whether you have whatever your access may be, whether it's a PICC line or a port, that's what we're going to be using our imagination that is going to be your access point here. This piece is called the microclave. So whatever your access is, we'll be connecting to the end piece, which is the microclave. So if we see a saline flush, I can take the cap off of that, and there's going to be a little air bubble in there. You might be able to see it go back and forth here. We want to get that air bubble out, so I will draw down on this plunger to break the seal. That's going to bring a little more air in, but it makes it easier to push it back out. So push that up and out. There you go. And we'll take an alcohol wipe. And we want to wipe down that microclave. On the end part here where we have threads, we're just going to take this alcohol wipe, wrap up around the end and those threads, and give it a good scrub for 15 seconds. So make sure you get the end and all those threads. A little time elapse. When that's all done, you can give it a couple seconds and you'll see the alcohol evaporate off of there. And then, let's see if you can see that, but we'll line that up in the middle and it'll compress and allow those threads to catch, so we can then turn and we're connected. It's about a half turn. We don't want to over tighten it. So once it feels a little taut, we're good. So again, the microclave here is spring loaded. We just line this up, push it in and turn. The saline flush is going to be 10 mLs. So we will push the full 10 mLs through. Some access lines will have a clamp on them. If you do have a clamp, you'll want to make sure to unclamp it so that you can push that through. If you forget, you'll figure it out real quick because you won't be able to push it. So we'll disconnect when that's done. Then we'll take the ball of medication, which will be refrigerated, and we'll want to take that out of the fridge maybe an hour to 2 hours ahead of time just to get it closer to room temperature. The end will have a cap. We'll take that off. And again, we'll get an alcohol wipe and wipe down that microclave for 15 seconds. So give that a good scrub, time elapse. And you can see, I think, that the end of your tubing will look just like the end of the saline flush. So it will connect the same way. So we'll line that up, push that in and turn, and we're connected. At that point, we'll want to unclamp. There will be a clamp on the ball of medicine on the tubing. So we'll unclamp that and the infusion will start. So to clamp that off, you would push it down. To unclamp it, we just pull back on it. Once we unclamp that medication, we'll want to start a timer. Most infusions are going to be around 30 minutes. We have 30 minute, 60 minute, and 90 minute infusions. So whatever your infusion is, just make sure that we unclamp it so that the infusion gets started, and then we either write it down or start a timer so that we give it the full duration to infuse. Because it's a pressurized ball, it'll give you a visual indication. As it infuses, it will start to get smaller. You'll start to see more wrinkles in that elastomeric pump. If it's 30-minute infusion, and you look down in 10 minutes and you don't notice that it's getting smaller, probably forgot to unclamp it. Just unclamp it and start the timer over again. So I'll put that down. At this point, what I like to do is go ahead and remove my gloves, take those off, because even if it's a 30-minute infusion, you're likely gonna touch your phone or a remote or something, and you're not gonna be sterile any longer. And sometimes when you're wearing gloves, you have the tendency to think that you're clean and ready to go. So just take those off so that you know when the infusion's complete, we need to wash our hands again or use hand sanitizer and put on new gloves. So in this case, I'll use hand sanitizer and get my new gloves on. And at this point, we're just repeating the process. So we're just following through that acronym. We've done saline, administer the medicine. So we can just clamp off that medication and disconnect from your line. And then again, we'll get the air bubble out. So draw down and push that up. Okay. And then we'll take a new alcohol wipe and wipe down your line again for 15 seconds before connecting and pushing. And that'll be another full 10 mLs. So last step is gonna be heparin. This is 5 mLs. It's a non-therapeutic dose. Heparin's a blood thinner. It's just basically enough to occupy the catheter and help keep blood from building up and occluding your line. So cap off, air bubble out, wipe down for 15 seconds, connect and push. When you're all done, you can clamp off your line. And if you have a swab cap, we'll just put a little swab cap on the end of your line. So the best way to think about this is anytime we go to do a flush, we need to get the air bubble out. Anytime we go to connect to your line, we need to wipe it down for 15 seconds. If we wipe down the microclave and then it touches skin or clothing or anything, it's not a big deal, but it just needs to be wiped down again. So once we wipe that down, we want to make sure it doesn't touch anything before we're connecting. So air bubble out on any flushes and wipe down for 15 seconds before connecting to your line. The way to think about it is if it's a PICC line, it's just a catheter going into a vein over towards the heart. So we want to do a saline flush to make sure the line's open. So when we administer the medicine, we know that you're getting it. We're going to do another saline flush to push any of that medicine on through. One, so that you get it, but more importantly, that we vacate the line of any medication. Some of these medications, if they sit in a line, can get a little sticky and start to build up or occlude that line. Last step, again, heparin, just enough to occupy the catheter and keep blood from occluding the line. So again, SASH, saline, administration of medicine, saline, heparin. We'll want to take the medication out an hour to 2 hours ahead of time to get it closer to room temperature. And the medicine can't freeze, so if you have any drawers in the fridge that get a little colder, just make sure to avoid those. You'll never be out of medication before the next shipment of medication comes. So we want to rotate the older medication to the front to use it first, and so on. So, okay, thank you very much.